it's great to be here. It's a fantastic venue, and thanks to the Board of Londonwide LMCs for giving us the opportunity to get such a cracking good programme together for you today. And all for free. Well, you pay for it in your levies, but you know, so. Look, this is the toughest of times. GPs, nurses, healthcare professionals, social services professionals, we do really tough jobs, really tough. And people just think we refer, don't they? That's what they think we do, and we're going to show them that that's not what we do. We do different. Patients don't realise how much they are at risk of losing what we do, losing it to the corporates, whether under the guise of new models or pure financial necessity, losing it to a mindset that prevails in some government circles that doesn't value our values as GPs, losing it because they've deprofessionalised us so much that we're increasingly unable to cope through no fault of our own. Now, the cavalry is not going to come over the hill. Even if there is a roadmap to salvation this week, it's not going to deliver for London in short order. And so, it's a massive effort you've made to get here today. And it's invaluable that it says over 300. I reckon there's about nearly 300 of you here today from so many different roles in general practice. And we need you to engage with this campaign. And here are all the links that you need for the day and afterwards. And we'll be telling you about a thunderclap. Anyone know what a thunderclap is? No, okay, neither do I. No, seriously, it's a big Twitter thing. And if you're not on Twitter, get on it and go hashtag GPStateofEmergency at Londonwide LMCs and follow the instructions on the email. And sometime down the line, there'll be a big noise about today. So, why am I so pleased that you found the time? A third of us have a GP vacancy. That's in a third of every practice there is a GP vacancy. The clinical workload has gone up. I think that's an underestimate. It says 16%. I reckon you can double that. 39 practices out of 644 responding to our recent survey are considering closing in the next 3 years. How bad is that? Rising population, going up exponentially, going to be 10 million near on very soon, and doctors are leaving, nurses are leaving. Patients are increasingly unhealthy with multi-morbidity that was confined to people in their 60s and 70s in the past, now actually being seen in our most deprived areas in their 40s and 50s. High levels of economic deprivation and accompanying social factors driving ill health. We're going to hear all about that. We know this stuff, but not enough is said. A third of English practices have a GP planning to retire in the next 12 months. It's that bad, it's a year. And nearly 10% have one considering leaving UK general practice. 10% feel they're unsustainable financially. And around the country, 600 training places are left unfilled. Doom and gloom. Not enough money. The 8 billion that's been announced just keeps the NHS standing still, and you know where that's going to go. Not enough support services. The reason we can do our job as well, and the reason we are the professionals that we are and that we deliver the best primary care around the world, is that we are supported or have been supported in the past by decent community services, decent social services, decent mental health services, and other paramedical services. These have dwindled. They're pretty well non-existent. So people talk about new models. Actually, the old model kind of worked. You just need people to actually be there for our patients and for ourselves. And we don't have enough people joining, putting the future of the GP model in question. So it's a bit of a 5-year forward review here. right up front, in the beginning, over the next 10 years, the NHS will invest more in primary care while stabilising core funding for general practice nationally over the next 2 years. That 2 years is up in October. Who feels they've been stabilised? Anyone been stabilised nationally? No. So words mean what they say, don't they? And actually, there's been no stabilisation, and yet we're into new models already. You can't have new models working effectively without stabilisation and without sustainability. 6 months to go, and PMS practice has been defunded. GMS practice are on a path to 7 years disruption. This is not sustainability, this is not stabilisation. And the Commonwealth Fund's 2015 survey showed this. 95% of GPs find general practice extremely or somewhat stressful. That's nearly everyone. How can you help yourself if you're nearly all stressed to bits? 22% of GPs have been made ill by the stress of work in the last 12 months. I and my team at Londonwide LMCs have seen this on a daily basis, moment by moment. There's not enough time for mindfulness because everyone's so stressed out with their minds they can't practice it. 70% of GPs find it very or somewhat difficult to coordinate care with social service or community providers. Yes. Anyone got a great relationship with their social services or community? Say so if you have. I want to know where they are. Boiling frogs. Everyone familiar with this slide? Okay, so I won't bore burning. Yes, I will, because it's wrong. This is GPs and staff being pressurised so much you get used to it, and you tolerate it and tolerate it, and eventually you say no or you die. You leave or you die. And actually, that's what's happening. Increased patient numbers, decreased funding, decrease in GP numbers. That's what we're in. So we are today declaring a state of emergency in general practice in London. Yes, the room did turn slightly red then. GPs in London and across the country are declaring this state of emergency. Patients risk losing their GPs unless pressures on general practice are dramatically eased. General practice is at breaking point. That's not safe for patients or staff. And the GPStateofEmergency.org.uk will give you emergency resources to help you through this time. So look inside your lanyards. There's a red card, because we're at Arsenal. And pull it out, if you can fiddle with it to get it out. Okay. So let's decide what we're going to show the red card to, shall we? You all got it ready? Bullying, bean counting and bureaucracy. Red card, keep them up. The CQC over-inspection. Yeah. Indemnity costs. Okay. So what can we do? Actually, some of this is in our hands. We can push back against that non-core demand. We can focus on what's necessary for patient care and not specifically what's necessary for the system. And we can get patients on board. Who's got patient participation groups? Good. What do you talk about with them? Diabetes, asthma, the surgery's not working very well. This is what you should be talking to them about, getting them on side. Look at those junior doctors. Look at what happens when the Save Our Surgeries campaign got patients marching to keep them open. That's what your patient participation groups are for, because they're going to miss you when you're gone. So we've got to make the effort to engage with our patients and get them on side, and we need to do it now. What are we doing at Londonwide LMCs? We've got, branded in red, all these new resources to help you. More pro formas, more notices for your surgeries, and more guidance on how to actually manage your demand. Because nobody else cares about the demand on GPs. Whenever you hear about demand management, it's always about secondary care. It's never about demand on general practice. This campaign is determined to show that we have demands that need managing. So we're going to be representing you, as we do, to all of these different bodies across the city as the capital's go-to organisation for general practice. So get your red cards out again. Do we like stoked up demand? What are we going to do with it? Do we like secondary care dumping? I know these are leading questions, but, you know, let's get cathartic.
Yeah.
Do we like letting down our patients? No, we don't. Patients are our purpose. And do we like letting down our loved ones? No, we don't. So GP State of Emergency is here. And I need you, one of you probably represents pretty much about a third of the practices that we've got. I need you to go back to your practices, and I need you to spread this message. And I need your partners and your other workforce and your salaried GPs and your locums to be gotten to buy into this message. And we need to create this surge of demonstrable knownness, if you like. And actually, we need to look after ourselves as well. So thank you very much for listening, and I hope you enjoy the rest of the day.